Welcome to AFMC TV. I'm Robin Linder.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults to Rebrand created down on the floor and play with their kids.
AFMC TV, thanks for watching and have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Brian Bell, and he is the CEO of what was Arkansas Hospice, now LifeTouch Health.
That's right.
Tell us, Dr. Bell, about the name change and how did you transition from Arkansas Hospice to LifeTouch Health?
Yeah, so for many years, Arkansas Hospice is who we were. I mean, that was the only company that we had, only thing that we did. So I'd say for 24 years, we were Arkansas Hospice. But about 10 years ago, we started expanding our services, right? And so as we expanded those services, we started to realize, we're more than a hospice. We do more for our communities. We do more for our patients. And so, we decided, okay, we have evolved as an organization. So we really need to evolve our name. So we decided and went through the rebranding process and got people and input and did all the things you do. And we had, the interesting thing, we had bought a hospice in El Dorado called LifeTouch. And so through that, we got that name. And so once we started experimenting with names and seeing what would work, that one just felt good to us, because that's what we do. We touch lives every day. And between all of our programs, we probably touch over 1,500 lives a day with our palliative care, primary care, personal care program. And so this name change is really an evolution of who we are.
So not sold or acquired.
Right. We were not sold. We are still that nonprofit hospice organization, the largest nonprofit hospice organization in the state. Who we were on September 30th is who we were on October 1st of last year's when we changed our name. We have the same board, the same leadership, same nonprofit status, all that stayed the same. Our same mission to care for people, Arkansans in the state, and give them the best compassionate care that we can provide. That did not change. We didn't get sold. Even I hear that all the time. Oh, you got sold to. No, we did not get sold. We are still that same nonprofit Arkansas company that we were on September 30th.
And you touched on this a little bit. There's a lot of what you offer because it's not just hospice care.
Right, yeah. So I think when you take for hospice care, right, it's you got that 6 months or what it's supposed to be. It can be longer than that. And so we always had that, organization, but our thoughts is how can we expand out that? How can we go upstream to take care of people upstream farther than that 6 months? And so we, about 10 years ago, we started our palliative care program. Probably 4 years ago, we started our primary care program, which is a lot of it based in ALFs. We do some home visits for those patients. And then several years ago, we got a personal care program, so take non-medical needs. And so what's kind of beautiful about that, they all work synergistically together. They support each other. So a lot of times we'll have a patient that will come into our palliative care program, and then we'll follow them, let's say a year or two, and then they evolve, their illness evolves. We'll transition them into our hospice program, and they'll stay there. And some hospice patients get discharged alive, and sometimes they'll go into our primary care program. And at the same time, our personal care program can work with all of those across that whole spectrum. And so I love it because we have this great continuum of care, this warm handoff, because they never actually leave our company, because they'll come in with one of our companies that we have, and then they'll transition to others. And that's the beautiful, they don't never have to leave what I call our umbrella of care or our family of care. They kind of stay in the family, because that's how we feel. They stay in our family of care no matter what's going on with their life or their medical conditions.
And how does this expansion help Arkansas families?
Yeah, and I think I just kind of talked a little bit about that, but we offer more services. And a lot of those services are in the home, like our palliative care meets you where you're at. Also, we go to rural places. I mean, actually, most of our places are rural. And really, in a rural Arkansas, there's not a lot of services out there. And so having a palliative care down in Monticello or Berryville or Batesville, where we have a lot of our services, hospice, palliative care, are in those areas, it gets access to them. It gets access to them things that they could not have had any other way other than what we provide. And so that's one of the big ways that we provide more access, deeper level of care for a longer period of time.
And we hear that this term silver tsunami is coming our way. What is this, and how is LifeTouch really changing or helping that?
Right. I think you hear that a lot. So that's really our baby boomers, right? They're kind of moving into this next generation and getting over 65. And as you get older, obviously you get more chronic conditions. And so we need more people to take care of them. And so one of the programs that we have that I really love is called our GUIDE program. It's Guiding an Improved Dementia Experience. And it's a CMMI, the Center for Medicare and Medicaid Innovation. And we were the only Arkansas company that was picked to provide this service. Now there's other companies that are coming in from out of the state to do that, but we're the only one in Arkansas. And with this program, you got to think about it, there's about 64,000 people in Arkansas living with dementia. So that's just dementia. Now there's traumatic brain injury, there's vascular dementia, there's other types of people with cognitive decline. We're not even counting in that 64,000. And these are very difficult for families and caregivers to get resources to help care for them so they can keep them in the home, keep them where that patient usually wants to be. And so with the GUIDE program, they get a navigator, they get resources. They actually get up to $2,500 a year in respite care. So if that family member wants to go take a break, we can have people come in to the home. There's adult daycare centers, nursing homes, places like that they can go that doesn't cost that family member any money. That's a free service that's offered through that GUIDE program. But the most important thing is just having someone you can call 24/7, day or night, which is what that is, and said, you know what, I don't know what's going on. Please help me. I need help. And that's what our GUIDE program does for dementia patients.
And you've got some really cool events coming up. Tell us what you have planned.
Yeah, I love it. So, I think hospice and palliative care, you kind of think it's not a fun thing. Well, we are a fun company, all right? We're having Party at the Plaza. I love the Party at the Plaza. It's going to be held on April 25th down in Argenta, 1:30. And we got bands playing. We have the Cleverleys. That's at the Grand Ole Opry. We have Chris Allen. Y'all know him. He's won American Idol, right? And so we have multiple other groups that'll be singing through the day. We have food trucks and things for kids, and just a great day to celebrate. I mean, that's what we're about as a company. We're about celebrating life, and nothing says life like a party. So hope everybody puts it on their calendar for April 25th at the Argenta Plaza at 1:30. Come on down and have a good time, enjoy, and help support our mission.
Where can viewers find out more about LifeTouch Health?
Sure. So you can get with lifetouchhealth.org or lifetouch.org. You can get it there. Or you can call us at 877-713-2348.
Well, Dr. Bell, thank you so much for being here and sharing the vision, exciting change, and excited about your event in April.
Thank you. I hope to see you there.
And that's it for this episode of AFMC TV. Have a great day, and thanks for watching.